Hello and welcome to the IHSS Caregiver Education presentation on fall prevention, created by Alex Hin, Ariel Valdivia, Emily Chan, Isabel Flores, Meredith Seaman, and Taylor Cohen, nursing students at the University of California, Irvine, and presented by Alex Hin
and Emily Chan. This project is supported federally by the Health Resources and Services Administration and the UCI School of Nursing, Division of Geriatric Medicine and Gerontology.
This presentation will include information on fall risk, which include statistics, risk factors, prevention tips, and the importance of nutrition. It also includes information on home fall prevention, including creating a safe home environment and several checklists to allow you to do so. And finally, this presentation includes information on transferring, including proper body mechanics and using a gait belt.
More than 1 in 4 Americans aged 65 and older fall each year, but less than half tell their doctor. Over 800,000 patients are hospitalized each year due to fall injury. Common causes include head injury and hip fractures. 1 in 5 falls cause serious injuries, and falling once doubles your chances of falling again. Falls are also the most common cause of traumatic brain injuries. Each year, at least 300,000 older adults are hospitalized for hip fractures. More than 95% of hip fractures are caused by falling. These falls are often caused by hazards that are easy to overlook but easy to prevent.
Individuals who are female, 85 years or older, or are of American Indian or Alaskan Native descent are at an increased risk for falls. It is also important to remember that fall risk increases with age. Therefore, it is important to constantly assess and reassess risk factors and implement new methods of prevention.
It is important to remember that falls are not a normal part of aging and that falls are preventable. Here are some risk factors that will increase one's chances of falling. Physical risk factors. This includes muscle weakness, lower body weakness, gait problems, poor vision, poor balance, which could be caused by some over-the-counter medication, foot pain, or poor footwear. Behavioral risk factors. This includes poor nutrition, lack of exercise, and lack of annual checkups. Environmental risk factors. This includes home hazards such as uneven steps and stairs, loose rugs, loose cables, and pets. Emotional risk factors. Many people who fall, even if they're not injured, become afraid of falling. This fear may cause a person to cut down on their everyday activities. When a person is less active, they become weaker, and this increases their chances of falling. Most falls are caused by a combination of risk factors. The more risk factors a person has, the greater their chances of falling. Remember, falls are not a normal part of aging and they are preventable.
And now we have fall prevention tips. Our first tip is to stay active. Go out and take a walk, exercise, or try weight-bearing activities for at least 30 minutes a day. Exercise improves your balance and makes your legs stronger, as well as are a great way to help you feel better and make you feel more confident. Our second tip, monitor medications. Review all over-the-counter and prescribed medication interactions to ensure that there are no contraindications or additional side effects. It is important to also remember some medications may make you feel sleepy or dizzy, putting you at an increased risk for a fall, while other medications, such as blood thinners, may put you at an increased risk for serious injury. Tip 3. Have a safe home. Get your home assessed and make clear pathways. We will be further discussing home safety later in our presentation. Tip 4. Go slow. Take your time getting around and get up slowly after you lie or sit down. Tip 5. Annual eye, hearing, and physical exams. Stay up to date with all of your exams and don't be afraid to communicate with your doctor, healthcare provider, or optometrist with any concerns. Tip 6. Healthy habits. Make sure you're getting enough vitamins, specifically vitamin D and calcium.
Healthy habits include nutrition. It's important to have balanced meals with protein and foods with high energy. Have moderate amounts of calcium and vitamin D. You can find calcium in milk, cheese, yogurt, and fortified soy products. Vitamin D can be found in eggs, fish, and being out in the sun. Make sure to have a sustainable amount of vitamins A, C, E, folic acid, and vitamin B12. Have plenty of fruits and vegetables and whole grains, and make sure you are hydrated. While typical meals and the amount of foods from each food group vary based off of individual health patterns, a balanced diet should include dairy, protein, grains, and fruits and vegetables. If you or your loved one do not eat meat or have a soft food diet, protein can also be found in lentils and beans. If you or your loved one do not often get hungry or get full fast, snacks, small meals, and protein shakes can help increase dietary intake.
Malnourishment is seen more and more in older adults, partially due to food insecurity, lack of access, or decreased consumption of healthy or strength improving foods. Malnourishment can make older adults more susceptible to frailty and sarcopenia, a decline in skeletal muscle mass. Nutrition is such an important aspect of life, and without proper intake of nutrition, the older adult population becomes more susceptible to falling and can have longer periods of recovery. If you or a loved one is experiencing barriers to food access, there are government programs and resources such as SNAP that will assist you in getting you a nutritious diet. Oral hygiene also plays an important role in nutrition, as dentures can cause difficulty in chewing. Therefore, having annual checkups and maintaining good oral hygiene is a great way to stay healthy.
Next, we'll be talking about fall prevention and home safety. This will include safety of the floors, stairs and steps, kitchen, bathrooms, bedrooms, and safety devices.
Beginning with home fall prevention floors. To avoid having to maneuver around difficult obstacles and furniture, ask someone to move the furniture so that your path is clear. Remove rugs, or use double-sided tape or a non-slip backing so rugs won't slip from under you or snag on assisted walking devices. Wear shoes both inside and outside the house for additional support. And always pick up things that are on the floor and always keep objects off of the floor. Coil or tape cords and wires next to the wall so that you cannot trip on them. And as a reminder, you can always have an electrician install more outlets in more convenient locations to make accessibility and wiring easier.
Home fall prevention, stairs and steps. Pick up things on the stairs and always keep objects off the stairs. Fix loose or uneven steps. Ensure that the stairs and steps are well lit and visible. You can also have an electrician install a light switch at the top and bottom of the stairs. Make sure your home has lots of lights by adding more and brighter light bulbs. Make sure the carpet is securely attached to each step, or you can remove the carpet and install non-slip rubber treads to each stair. You can also paint a contrasting color on the top edge of all steps so that you can see the stairs better. For example, use a light colored paint on dark wood. In addition, fix loose handrails or install new ones on both sides of the stairs and for the entire length of the stairs.
Home fall prevention in the kitchen. Rearrange items in your cabinets so that the items you use more often are on the lower shelves, preferably at waist level, to prevent excess, strain, and possible imbalance. If you must use a step stool, ensure that it is sturdy and has a bar to hold onto so that you or your loved ones have proper support and balance when reaching onto higher shelves. And as a reminder, never use a chair as a step stool, as it can be imbalanced and puts you at a risk for injury.
Home fall prevention, bathrooms. Put a non-slip rubber mat or self-stick strips on the floor of the tub or shower. Have grab bars installed in the tub or shower and have grab bars installed next to the toilet to prevent falls.
Home fall prevention bedrooms. Place a lamp close to the bed where it can be easily reached and turned on at night to provide a quick light source. Install a night light so that you can see where you are walking. And as a reminder, it is the safest to have uniform lighting. Therefore, adding lighting to darkened areas of a room can help you assist in fall prevention.
Lastly, home fall prevention, safety devices. Keep emergency numbers in large print near each phone. Use wireless or cordless phones to prevent any possible tripping. Put a phone near the floor in case you fall and cannot get up. Think about wearing an alarm device that will bring you help in case you fall and cannot get up. These devices are easily accessible after a fall and are used to quickly alert authorities to get help.
We will now be showing a patient transfer demonstration video created by the Family Caregiver Alliance. This video will teach proper transfer techniques as well as how to use a gait belt to further assist you and your loved ones.
Moving or repositioning someone who has problems with mobility can be very challenging, but with the right techniques and approach, it can be done. All you need is a little education and using gravity and leverage to your advantage. Here are some basic but very important rules. First, never lift anything or anyone that you cannot comfortably handle. Prepare to lift with your feet a shoulder width apart, back straight, and one foot slightly in front of the other. We'll call that the proper stance. Also, let the legs do the work, not your back. Rule number 2, plot out your move and be sure of what you can and cannot do. If your loved one can help with the move, let him or her do so. Also, make sure that your loved one's socks or footwear do not have slippery soles. Rule number 3, make sure you don't have to move someone too far from where you're starting. Bring a chair or wheelchair close to the bed, for example, lock the brakes, and keep foot and arm rests out of the way. Always let your loved one know what it is you're planning to do. Be gentle but direct. Before you lift, get as close as you can to your loved one and avoid having his or her arms around your neck. You could both fall that way. Remember to keep the proper stance, back straight, knees slightly bent, and weight balanced evenly. Now pivot and don't twist your body towards your destination. As you pivot, relax the shoulders and begin to lower. If you need more help with this sort of maneuver, you can use a gait belt or a transfer belt like this one. This is a cotton belt with a metal buckle which is placed around a person's waist. A good rule when fastening this belt is the 2-finger rule. As you tighten, make a space so 2 fingers can fit inside. This makes the belt tight enough not to slip, and you can firmly hold it to help with lifting or lowering. These same transferring skills can be used to support your loved one in and out of a car or on and off the toilet. At the toilet, have your loved one hold on to a grab bar while you help with clothing. Notice the elevated toilet seat here. It's a big help if your loved one has knee problems or trouble with walking because it reduces the distance needed to lift or lower. It simply rests or bolts onto the regular seat. If no grab bar is available, pull the chair up diagonally to the toilet, move away the arm and foot rests, and help your loved one swing over to the toilet seat and then back when the toileting task is complete. If you're moving your loved one into a car, roll the wheelchair up close to the passenger's seat, lock the chair's wheels, move the footrests, and lift him or her up. When you are both standing, pivot toward the car seat and lower him or her into the car, making sure the head doesn't bump into the frame. Then, with your hands under your loved one's knees, lift his or her legs into the car. If you're putting your loved one to bed, first sit him or her on the bed's edge and as far back as possible. Then, gently lift and swing the legs onto the bed. This will help his or her upper body to roll into place. Once your loved one is lying flat, place a small pillow under his or her head to allow for the spine's natural curvature.
Hey Jimmy, I'm going to push you up a little bit.
To move your family member further up on the bed, get him or her to help by bending the knees and, if possible, pushing up against the mattress.
There we go.
To help your loved one sit up on the edge of the bed, put one arm under the shoulder blades and the other arm under the knees. Get in the proper lifting stance and tell your loved one exactly when you're going to move. Gently bring the legs over the edge of the bed as you lift his or her body into a sitting position. What we've been showing you here is how to move or position your family member safely, but accidents do happen, and despite all our good intentions and efforts, your loved one may fall. If it's a slow slide to the floor while you're moving your loved one, let him or her down gently to the floor. If you try too hard to hold him or her up, both of you may risk injury. On the other hand, if the fall is hard, call 911 and get professional help for your loved one as soon as possible. So, how do you get your loved one up off the floor once he or she has fallen? If your loved one doesn't use a wheelchair, help him or her get on hands and knees and then bring the strongest foot forward while half kneeling on the other leg. Now, with a chair or other sturdy object in front, help your loved one pull up with his or her arms and push off on the stronger foot to a standing position with both feet together. There are a number of devices you can use to lift, transfer, or help your loved one, but the ones we've covered in this video are for the home caregiver who may not have access to these. Talk to your doctor, physical therapist, or occupational therapist for advice on those which are right for your situation. And finally, a reminder. If you're helping to move a loved one with ambulation challenges, you as the caregiver need to focus on your own health and well-being. In order to be the best caregiver you can be, you need to take care of you.
We hope that video provided you new information on how to support and transfer your loved ones in a healthy and safety manner. Thank you for joining us on our IHSS education presentation on fall prevention. My name's Alex.
And I'm Emily. We hope that you've taken away some good tips on home safety and fall prevention.
If you have any questions, please feel free to email Professor Jung-Ah Lee at jungahl@uci.edu. That's JUNGAHL@uci.edu. Thank you.